SENDoc project is a European project. It's a Northern Periphery and Arctic Interreg project. We started the project in 2017 and it completes the end of this year, 2020. So it's a 3-year project and it involves 4 main partners. A physio partner in Finland, clinical partner in Sweden and a technical engineering partner in Cork, as well as ourselves in Ulster. The core aim of the project is to test mobility, strength, balance and also wellbeing and exercise through sensors. Can we use sensors to measure all of these things to support independent living?
When the project was initially written up and developed, it was thought that there would be one sensor system developed for one particular condition and distributed to all the partners. When we started the project quickly evolved into working on multiple demos, multiple conditions, multiple technologies.
We have tested so far 17 different sensor systems that are connected to elderly persons' independent living. And we have a certain protocol where we test the accuracy together with golden standard equipment that we have. And the next step, if the system is shown to be accurate enough, we have tested them in real working life rehabilitation processes, both in clinics, in-home rehabilitation teams.
Our unit up in Västerbotten in Sweden is a test bed. We are doing a lot of testing, trying to develop better technology for care closer to the seniors in their homes. We have been looking at the frailty aspects and mostly on the risk of falling and risk factors for falling and how to measure them with connected health.
We have noticed that the sensors are not in the standard that we thought that they will be, but also we noticed that maybe also many things have to change in the hospital and in the healthcare service delivery model, because you need to have, for example, training to patients and to staff members. They need to know how to use these sensors, how to interpret these sensors, and they need to know where to put them so they can have repeatable measurements.
When developing this kind of activities and equipment, there has to be very close cooperation with computer engineers, computer scientists, and us rehabilitation staff as an end user.
As engineers and as scientists, you sometimes can be in a little box and not think too much about the users and actually what you're making can actually be being actually used for. And of course, as an engineer, the chance to test so many technologies with real users, and in particular get some of our novel technologies out of the lab in a real life setting, like with real users, and finding out the good and the bad from our technologies.
It's fantastic to be able to join in the project because it's interdisciplinary. We are meeting colleagues from 3 other countries in other specialities. I think it's in the crossroads between the disciplinaries that the magic happens.